Okay, thanks again for having me here and the opportunity to talk with you guys. So the format for this session is I'm just going to give a really brief PowerPoint talk just on an overview of survivorship issues. And then we're going to hear from Paige and offer an opportunity for questions and answers across the board. So I'm just going to go through here. Let's see if I can get this started. All right, Taylor, does my PowerPoint come up okay?
You're good.
Okay, all right. So just a couple odds and ends with these couple slides here. I don't have any relevant conflicts of interest to disclose. When we talk about survivorship, a lot of the literature and a lot of the studies that have been done on survivors are on young adult survivors of pediatric cancer. Now, aplastic anemia is not necessarily a cancer, but many of the treatments are similar to what cancer patients get. And not all survivors are young adults. As we've seen today, there's folks that are part of the symposium that are of all ages. But that's where a lot of our literature comes from, but we can extrapolate quite a bit. And then I'm just going to talk a little bit about survivorship and late effects in general, and then we're going to move on to our patient panel. So why is survivorship important? Well, these curves here, down here on the x-axis is time since diagnosis of aplastic anemia. And on the y-axis here is the percent of patients surviving. And each one of these curves represents successive eras of treatment. So down here starts in the 70s, up here is in the 80s, and over here is in the 90s and into 2000s. And what you can see looking at these two charts is that through successive eras of treatment, treatment has gotten better and more folks are surviving. That means that we need to make sure we're taking care of survivors because there's more and more of these folks like yourselves out there. So what is a late effect? Well, late effect in general is some type of long-term complication of a disease or part of the treatment for a disease that can have impacts on your health as you get older. For aplastic anemia, for example, what is the impact on the residual bone marrow that wasn't affected by the aplastic anemia? When you get chemotherapy or radiation, what's the impact not only to the disease that was treated, but the healthy tissue? So for example, if you undergo a bone marrow transplant for aplastic anemia, how is fertility affected? What other long-term complications can come up from this? And what do you need to be aware about to make sure that you're staying healthy long-term? And then there's other complications that can arise of therapy. So for example, if you had a bone marrow transplant and developed graft versus host disease, some of those treatments for graft versus host disease can have their own long-term effects that are important to keep in mind. So late effects in general, they do occur commonly, but they're really associated with specific exposures. So knowing what disease you had and how it was treated is important to figure out what is important for your long-term health. Some long-term effects are a normal part of aging. So for example, we know folks that have had a bone marrow transplant are a little bit increased risk for high blood pressure and high cholesterol, but this is also something that happens as you get older as well. So these late effects occur on a spectrum from very mild things to more concerning or life-threatening things. But we also know that focused screening, so when you go to a doctor and are taking part in a survivorship program, you can be screened for a lot of these things, and a lot of these things have different treatments available to help keep you healthy. And one of the good things is, just like we saw that the outcomes for folks who have undergone transplant for aplastic anemia have improved over time, we know for survivors of childhood cancer, the long-term implications of being a survivor have also gotten better. So on this is a paper that was published back in 2016. This is folks that were treated and were all 5-year survivors of childhood cancer. So this is the time from diagnosis. So this represents when you're diagnosed, and this here represents at 5, the time you become a survivor. And on the y-axis here are the percentage of patients that died afterwards. And what you can see is, yes, of course, people die later on as they get older. But as we've gone from the 70s to the 80s to the 90s, the rate of people dying later on who are survivors has gone down considerably because, one, we've gotten better at treating these long-term effects, and two, some of our treatments have become less toxic and led to less late effects.
Hey, Dr. Rotz, I don't mean to interrupt you, but you've gotten a couple requests to change the setting to where you can only see one slide. I'm not sure if you're able to change the display settings but
Oh,
someone
thank you.
might be able
Let's
to
see here.
see it better.
So you guys are seeing two slides at once, like the current slide and the next slide?
Yeah, so someone's not able to, a couple people may not be able to see it well.
Are you seeing just kind of like the generic PowerPoint slide right now?
Now you are, this is the shared content is, let's see, yeah, people had asked in larger screen, well, slide screen, so you can only see one slide, so.
Well, let's see what I can do.
Sorry.
Okay. See what that does. Is that better?
Yep, that looks good.
Okay. Well, the good news is no matter what, we're already halfway through my short talk. Thank you for pointing that out, Taylor. Okay. So one of the questions out there is how do we make sure that survivors get the best care possible? Well, what you see here is several different articles, some from the medical press and some from the lay press. And these are all different studies or articles that talk about how young adults can be lost in transition as they get older, as they graduate from pediatric programs and get older, or kind of meet the standard 5-year benchmark as a survivor. They can be lost in transitions of care. So I think this is really important for survivors to be aware of, so that they can be aware that when it comes time to move on from the original treating physician, to make sure that they're advocating for themselves as much as possible as they kind of leave that original medical home. So this is a study here published a couple of years ago. It's about general internists, so primary care physicians, adult primary care physicians, their knowledge and their preferences about taking care of long-term survivors of childhood cancer. So this is like asking, the general internist down the street, how comfortable are you taking care of a survivor of childhood cancer or a bone marrow transplant survivor? How comfortable do you feel taking care of these folks, and what would you do for them? And there's a couple concerning things here. So first of all, the average internist in the last 5 years had only seen 1 to 2 childhood cancer survivors. Childhood cancer survivors like yourselves who may be on this call are not the bread and butter for the average family physician out there. A lot of these folks never received a treatment summary, so they're trying to take care of folks without knowing exactly what treatment they got. That's another hole in the care. And on average, when you ask these people how comfortable they were taking care of the average long-term survivor, most people said they were somewhat uncomfortable. Again, this is not the usual 50 or 60-year-old patient who's got high blood pressure type thing that they're taking care of. And then further, in this study, these internists were sent a vignette, so a little like paragraph about a hypothetical patient, in this case, a young female who had Hodgkin's lymphoma, and they asked, what types of studies would you be ordering to make sure that you're keeping her healthy? And most of the respondents did not know the proper things to do. So to me, this points out the need to empower patients so that they are asking the right questions and can also help take care of themselves long term. So where do the gaps in care for young adult survivors come in? Well, hematologists like myself don't always do a good job communicating with the primary care physicians. Again, we just saw 72% of those primary physicians never received a treatment summary. Long-term survivors are a rare occurrence. Again, even if people do get a treatment summary, it's not what they're taking care of. They're not the type of patient that is being taken care of on a normal basis. And a lot of times patients become disconnected from their original treatment center. So different treatment centers have different models. So a lot of times after you hit a certain age, whether it be 18 or 21 or 25, you'll age out of being treated at a pediatric center. A lot of times if you've had a bone marrow transplant and you're doing well, you'll kind of be discharged from the transplant center at 5 years. Other times, especially in young adulthood, people are moving around, whether it be for education or work or family. That's a time period where you may be moving around quite a bit and lose contact with the original folks that took care of you. And I think really importantly that, sometimes we forget about is patients may not want to come back. Some of this is not very pleasant. And sometimes people want to just get on with their lives and don't want to re-engage with the medical system once they're better. So how can patients and doctors find out about late effects? So I think I would point folks to 2 general places where they can go on the internet to find out knowledge on themselves, which I think this is a really good source of truth for people if they want to do their own research. So for childhood cancer survivors or bone marrow transplant survivors, the Children's Oncology Group publishes these guidelines at survivorshipguidelines.org. These are really comprehensive. There's a couple different versions. There's the most comprehensive version, and then there's a little bit of a simplified one that you can check out. And then in particular for folks that have had a bone marrow transplant, bethematch.org, which is run by the NMDP, has a whole section on survivorship guidelines as well that you can check out. The last thing I'm going to talk about is just a couple of brief survivorship specifics that if people are not at all familiar with survivorship and some of the things that can happen, I'm just going to point some of those things out. And then we're going to move on to the next section. So the way this is just really written for aplastic anemia. And most of treatment for aplastic anemia comes in one of two varieties. Either you get some type of immunosuppressive therapy or you undergo transplantation. And for immunosuppressive therapy, there's a couple things to consider. Generally, immunosuppressive therapy is less toxic in terms of long-term side effects. But some big questions out there is, once you've had all this immune suppression, do you need to be revaccinated for things? So everybody gets, childhood immunizations. But when you go through this whole immunosuppression process to try to get aplastic anemia under control, you may lose immunity to some of those things that you were immunized to when you were younger. Cyclosporin is a good drug, but it's not always a benign drug. There can be issues with kidney disease or skin cancers with that. If you received a lot of transfusions as part of treatment for aplastic anemia or MDS, issues with iron overload can occur, or you can develop antibodies to blood products that you may have been transfused to. And then more importantly, to consider for people is if you've undergone immunosuppression, there is a risk of progressing to AML. That risk is probably somewhere between 10 and 15%, depending on what study you look at about 10 years, and it's unclear if that risk plateaus. So just because you've seemed to have been cured of your aplastic anemia doesn't mean necessarily that you can totally break away from surveillance and so forth. And then from transplant, I would just break down complications into two issues. One would be dependent on the type of chemotherapy or radiation that you got as part of conditioning with transplant. Fortunately, the conditioning regimens for aplastic anemia are generally a little bit milder than what they are for other things that people are transplanted for. Fertility is certainly a concern, and I think it's important for people that may be coming up against the bone marrow transplant process to talk with their team about fertility preservation options. But also know that even after treatment, there's options available for subfertility. Just because fertility isn't optimal after treatment, sometimes things like IVF may be an option for people. Particularly for younger folks who may have been treated by transplant, there's endocrine and growth concerns, as well as anybody who gets chemotherapy when they're younger, that can lead to more dental issues as well along the way. And then, of course, there's things that are a little bit independent of the conditioning regimen. Graft versus host disease certainly plays a role in some of the long-term effects, and the treatment for the graft versus host disease can lead to a myriad of other issues that we can talk about if people have specific questions. So with that, we're going to hear from Paige and Taylor a little bit, and possibly another panelist if he's able to join in. And certainly we're able to answer questions to the best of our ability. They have them, and me and Taylor have our emails up here if you have questions later on as well. So I'm going to stop sharing my screen and let Taylor take it away.
Awesome. Thank you so much, Dr. Rotz. So I'm Taylor. I am a social worker, but I would like to have Paige start off by just kind of introducing herself, and if you want to give your name, age, that you were diagnosed, and just kind of give a little background if you can.
Paige, before you get started, Taylor, I didn't know if you noticed Justin was able to join us.
Awesome. Hi, Justin.
Yes.
Hey guys, I don't know if you're able to hear me or not.
Yeah.
Oh, awesome. How we doing, guys?
Good.
Good. So once Paige is done introducing herself, if you want to go ahead and introduce yourself as well, that's awesome. I'm glad you were able to join us, Justin.
Will do. Sounds good.
Awesome. Thank you so much, Taylor. So really excited to be here with you guys today. My name is Paige Cranwell, and I am 26 years old. I was diagnosed with severe aplastic anemia at the age of 23, so a short 3 years ago. The best treatment option for me was a bone marrow transplant, which I underwent 3 years ago at Johns Hopkins in Baltimore, Maryland. And today I'm doing really well. I'm a 26-year-old. I live in Columbus, Ohio, and I have my life back. So I'm just so thankful for everything Johns Hopkins was able to do for me. It was a long journey, and I'm sure we'll get into some of that in a few, but just really thankful for the advancements in medicine and science, because truly that is the reason why I'm here today.
Awesome. Thank you so much, Paige. Go ahead, Justin, whenever you're able.
All right, so yeah, I'm Justin Gildar. I was born and raised in Cleveland, Ohio, and I'm currently living in Columbus. I was diagnosed with severe aplastic anemia in March of 2013, so 7 years ago. I was a junior in high school, just finishing up my wrestling season at the time when I was diagnosed. I was brought to the Cleveland Clinic, and I was there for 2 weeks. I think I was inpatient for 2 weeks, and before I started my ATG therapy, because there were no matches for me for a bone marrow transplant. And then I was in the hospital for another 8 days going through that treatment. And ever since then, I took my cyclosporin, I think for a year and a half, 2 years. And then since then, I've been doing great. I was living in Colorado, learning to be a snowboarding instructor, and then I had to come back because of COVID, but I'm planning on moving back there next October, and things are going very well. I'm very thankful for everyone at the Cleveland Clinic for what they did for me, because that's why I'm here today.
Thank you so much. So you guys were both teenagers and young adults when you were diagnosed. So I'm assuming, Paige, you were starting out with your early career, and Justin, you were in high school. So how did this impact your career and your education? Whoever wants to go.
Yeah, I can go first. So I had just graduated from the University of Kentucky, go Cats, and had actually started a career in development. I currently work for St. Jude Children's Research Hospital out of a small local fundraising office here in Columbus. So I had just started my career. I had just graduated. I was really excited just to, kind of start the second chapter of my life. And about a year into the job, I just started experiencing some really bizarre symptoms. Was really tired all the time, short of breath, feeling very nauseous and vomiting a lot. And I kind of went to urgent cares, and no one really knew what was wrong with me. So eventually I actually went home to my parents' house. I'm originally from the DC area, and was admitted to an ER and was there for about 6 days, just getting every test under the sun, it felt like. And we finally decided to do a bone marrow biopsy. And it was interesting at first, doctors came in and they were like, we think you have leukemia. And then another doctor came in and he said, I don't think you have leukemia. I think you have a rare form of bone marrow failure called aplastic anemia. So I was actually diagnosed at a local hospital in Arlington at Virginia Hospital Center, and then was referred to a couple of treatment centers, and eventually ended up at Johns Hopkins, and started to undergo my treatment there. But yeah, it's, my life was put on pause, and I was young and excited to start my career and prove myself, and all of that was put on hold for about a year and a half. So.
Yeah, I guess for me it was very similar. Everything, I was in high school, I was playing sports, I was thinking about getting ready to apply to colleges and just move on to that next chapter of my life, and everything it kind of hit me like a brick wall. I had no idea. I knew because I was in wrestling season that something was wrong. I just didn't know what it was. And then one day at high school, the school nurse and the officer, they stopped me in the morning, and they were like, hey, we've been noticing you have been looking so well. Your teachers have been saying you've been falling asleep. We called your mom. We're going to go and get you a blood test. And I go and get the blood test, and I think nothing of it. Because the doctors had told me that my numbers were falling very slowly over time. So I was able to be okay at be active at lower numbers, more so than someone else who the onset was very quick. And so I thought I was completely fine. I had no idea I was really that sick. And I get the blood test, and then they call my mom and they're like, you need to get him back to the hospital this second. And that, like, from then on, it was just very scary. I was very sad during that time. You know, I had all these plans to do all these things with college and just get on with my life, you know, hopefully move out of the house. And that all just got put on pause, and it was really just very frightening. I was definitely very lucky to have the support system that I have. But yeah, it was about like a year and a half going through the treatment. You know, I had to stay in the port in my chest. I couldn't play sports. I couldn't really leave my house because I was, you know, because of the chances of getting sick. And it was definitely very hard. But in terms of college, you know, I'd say I wrote my college essay, and it was a pretty bomb college essay. So I think that helped me a little bit. I think it is a great story for, you know, any survivor. You know, it proves that we have like some fight in us, you know. So I think that helps with any struggle in the future, having been through something so rough. And in terms of work, you know, right now, I was a snowboard instructor at Keystone in Colorado, and I do plan on going back. But right now, I am a tree climbing arborist, which is pretty cool. I just love anything outside. I have a degree in wildlife conservation biology from Ohio University, and yeah, I really, you know, I'm a lot more conscious about my health than a lot of my peers, but I think I live my life pretty much the same way that they do now. So everything's great.
So it sounds like for you, Justin, that at first it definitely immediately affected your education because, of course, you were in the middle of high school looking forward to college, but you talked about the fighting aspect and how that has kind of pushed you through college and where you are now and the career you have taken because of the fighting aspect in you too.
Yeah, absolutely. It's taught me a lot, and especially about, you know, my mental and physical ability, you know, to overcome something so rough. So I know I can do it.
Yeah. How has it impacted your relationships with peers, and also has it impacted romantic relationships at all, either during your treatment or even after, when you had to disclose that you guys went through treatment?
So I definitely had a very rough situation when I was in high school. My high school girlfriend, she got mono while I was like probably a month into me being diagnosed. So that was rough. I remember fighting with my mom and the doctors about just wanting to be able to like kiss my girlfriend. And it was the biggest deal in the world not being able to do that. Mm-hmm. So that was rough. But with like friends, you know, it just made me and a lot of my friends a lot closer, because a lot more people than I thought reached out and really like did what they could for me. People that I never had thought would do that kind of stuff for me really reached out, whether it would be, you know, them buying me lunch one day or them sending me a card. I didn't bring it with me because I'm actually on vacation right now in New York, but I have a bunch of letters from all the people in classes like signing things and sending it to me, and like they sent me flowers and all this stuff in the hospital, and it was awesome. And so I would say a lot closer to a good amount of my friends because of it.
Yeah, and I would say for me too. So I was diagnosed at 23. So I had finished high school, had finished college or undergrad, was working my first job, and was with my high school boyfriend at the time. He actually pretty much gave up everything to take care of me. He quit his job and he moved with me to Baltimore. I think from a patient perspective, it's just when you have like that type of support, it just means so much more. But you know, our relationship was so different, you know, because of the things that I was going through. You know, I wasn't able to do a lot of the normal things that we did. But, you know, he was just so incredible. He, again, like I said, he gave up a lot for me. He was there for me every step of the way. When I was in treatment at Hopkins, so a little bit of a backstory on Hopkins. they actually treat their patients on an outpatient basis. So I went to an ambulatory, basically bone marrow clinic every single day. And if I wasn't critical, I wasn't inpatient. So Hopkins has found that their patients do significantly better when they're treated on an outpatient basis. So we had a small, tiny apartment in Baltimore. And if I wasn't critical, I was just visiting this clinic every single day. So I was there literally for like 8 to 10 hours a day, receiving blood products, chemo, different medications that were required for transplant or in preparation for transplant. And he was there for me every single step of the way. I also had, different antibiotics that I had to take at home. My family, along with my boyfriend, they, just really helped in, hooking me up to my port at home and just giving me that type of support. And I definitely agree with Justin. Like I said, I was 23 at the time, and a lot of people that I had lost touch with from high school, college, you obviously get a whole new scope of friends and life and experiences, but some people that I had lost touch with, I became back in touch with, and people just supported me in tremendous ways. I got so many cards. I loved receiving mail. It's crazy, like the little things, but receiving mail and opening that in a hospital room was just honestly incredible. So many packages, flowers, meals brought to Baltimore. Those were all so appreciated, and I never could have expected just the outpouring of support from everyone in my community, whether that be from college, high school, my parents' friends, and honestly, people that I didn't even know. I've just been able to connect with so many people on various different levels. And now kind of, sitting here 3 years later, I'm just so thankful for this experience. It really has just put my life into perspective. And I feel like I have purpose now in my work and my personal life. And I hope that, you guys find this inspiring. There is a light at the end of the tunnel.
We do have a couple questions, it looks like. It's been from the audience. One question for Paige and one question for Justin. So Paige, did you have IST before a bone marrow transplant?
What does IST stand for?
Immunosuppressive therapy. So like
Yeah.
ATG and cyclosporin.
Yeah, I did. So a little bit about my story. I don't know that I got into this, but happy to share. So like I said, I was treated at Johns Hopkins, and I actually didn't have a fully matched donor. I underwent a clinical trial at Hopkins and had a haploidentical match, and my younger brother, who was 20 at the time. He is literally my savior, and we used to fight all the time when we were kids. And now I tell my parents, I'm like, oh my gosh, no, we can never fight again. I'm forever indebted to you. But I underwent the clinical trial. I was number 7 at the time, and I believe there are about 20 of us now. So essentially, for all of those on the phone, haploidentical match, if you're not familiar, half of our characteristics were the same and half weren't. So there definitely was some increased risk for rejection and graft versus host disease, but because he was a related donor, and because I needed a transplant pretty fast, I had been experiencing symptoms of severe aplastic anemia, we think, for about a year. He really was my best option. So I did undergo ATG cyclosporin. The serum was derived from a rabbit, and then also immunosuppressive therapy, and was on that literally throughout my entire treatment, and then took immunosuppressive drugs about a year after I received my bone marrow transplant.
Thank you. And then Laura also asked, Justin, what was your treatment for aplastic anemia?
So I did not have any matches for a bone marrow transplant, so I went through the ATG therapy, and I believe mine was horse-derived.
And then she also just said, thank you for sharing your stories. The very best to you.
Thank you.
Oh, sorry. Did someone try to say something?
I just said thank you.
Okay. It's hard to tell sometimes over virtual here. I do want to ask, could there have been anything different to have a smoother transition from active treatment to surveillance and long-term survivorship?
Yeah, I can take that first. So I think like something for me, being very transparent with everyone on the phone, when I was undergoing treatment, it kind of I was at Hopkins, and everything seemed very scheduled and detail oriented. And I just kind of went through every day, day by day, had a schedule, was supported by family, supported by a boyfriend. But I think for me, the mental part of after treatment and what my life looked like, I just wasn't prepared for that. I basically had been with someone, whether it was my boyfriend or my parents, every single day. And then I moved back to Columbus and tried to, regain everything that, I once had back. And I think for me, that was really, really, really challenging, just to kind of, obviously, like I had aplastic anemia. It's always going to be a part of me, but how can I kind of shift and take my life back and use this as a, platform to, share my success, but also move on. So I would definitely say the mental part for me was probably a lot more challenging than the actual treatment. Because, I moved back and it was just me here in my 1-bedroom apartment. And, as a 23-year-old at the time, there were so many things that I felt like I still didn't have back. I went through chemo, so I lost all my hair. I felt like, as a young woman, a piece of my identity had been taken away. And it was hard to, kind of fit in with friends and, essentially relate. Everybody was kind of cautious around me, and I was like, it's okay, guys, it's still me. I'm still here, but it just kind of slowly took me a long time to, get back into the swing of things and just fully appreciate me for me. So probably the mental part for me was the hardest.
I would say if the hardest going through for me was like a lot mentally, but it was a lot had to do with wrestling, because I was diagnosed at the end of my wrestling season, my junior year. And because I guess I had symptoms throughout that entire season. That season kind of fell apart for me, wasn't the best. And then my goal for a wrestler in high school was to be a state champion in Ohio. And I was working my butt off, and I was training very hard and getting pretty close to being there. And then to go into my senior year, the year that I was expecting, that to happen, and then I got diagnosed, and everything kind of just fell apart for me. And then my doctors allowed me to wrestle my senior season, but it wasn't the same. I wasn't where I was before. And that was very, very hard for me, especially because me and Dr. Hannah, every time that I was in the doctor's office, would fight about me cutting weight. And he would get very, very upset with me, because every time I had to go in there, I had to stay an extra hour or two because I needed fluids, because I actually think at one point I almost needed to go on dialysis because I was so dehydrated. So that was just really hard for me, because I wanted to be the best wrestler I could, and that kind of went against everything the doctors were saying. And at one point, I think I told Dr. Hannah that I would rather die on the mat than in the doctor's office. So it was that serious for me. So that was very, very difficult for me to have to slow down on the work that I was putting in to be the best wrestler I could be. So that was very difficult for me. And then just, the mental aspect of just anything other than that wrestling, things that I saw all my friends doing. I remember there was an Alt-J concert in Cleveland that I wanted to go to, and that all of my best friends were going to. We had this plan, I think, for like over a year. And I think I had been going through treatment for a good amount of time at this point. So it was like a question on what my numbers looked like throughout the week before the concert. And they just weren't looking so hot. So I wasn't able to go. And that, me being in high school, I was young, I was fighting with everybody who was telling me all these things that I couldn't do. So that was really hard. And it was hard, especially on my mom, because I know that she wanted me to be able to go and do all these things, but she knew where I was coming from, not wanting to listen to the doctors, but she couldn't let me go and do all these things I wanted to. So it was hard on her to tell me no and to fight with me. So that was hard, but it definitely in the end made, like I said, with my friends, it made our relationship stronger. So it ended up working out in the end, and I'm all healthy now. So I'm happy that I didn't end up going to that concert or pushing too hard in wrestling. So so I'm able to, live normally and healthy now. But those were very, very hard for me. And like I said, with my girlfriend getting mono, that was rough. That was like my world had ended back then. But yeah, those were very hard to get over.
Yeah, for sure. I mean, those were part of your identity, and that was very important to you back then. So, I mean, even though you knew the severity of your disease, when something's so important to you, it's hard to focus on treatment when you really want to do something like that.
Mm.
And sometimes for you, Paige, for example, for you, Paige, when you're going through treatment, you're kind of in survival mode. And so the mental health aspect doesn't really hit you until you're done, and then everything kind of swarms in. And then we do have one other question here. Justin, how are you monitored now to watch for any reoccurrence of the disease?
So I get a blood test usually about once every 6 months, and since I've been doing that, I have had nothing has been abnormal. Everything has been great. And then I think I just need to go into I think I'm due for an appointment at the clinic. I think I need to see Dr. Hannah every other year. So I'm really not too highly monitored. I'm pretty free now. I've spent a lot of time in the past in the hospital, and it's pretty great for them to tell me that, I only want to see you every other year. It's been pretty nice.
Paige, do you have to do anything right now to continue monitoring?
Yeah, so I'm about 3 years out, and I will be considered cured in 5. So I still visit Hopkins every year. I have a wonderful relationship with my hematologist oncologist. She's just absolutely the best. And I go about every year, and honestly, it is so heartwarming and just so special to visit a place that, at once in your life, it was such a low. And now I love going back and seeing my oncologist, but also seeing, all of the nurses that supported us and helped us along the way. All of the doctors that were in, the ambulatory clinic. I love going back and seeing them, and even some of the faces in the lobby. It's so fun to, kind of be on the other side of this now, and, go back for those very important checkups to make sure that everything is okay. But also in a way, just kind of, give thanks to, the incredible teams that, get us to where we are now. Like, if it wasn't for you guys, truly, I wouldn't be here. So it's humbling for me to go back and, just say thank you.
Is there anything you wish your physician or other members of the medical team knew about aplastic anemia or the treatments you've gone through?
For me, I would say no. Again, I'm an open book. So I was treated by Dr. Amy Dezern, and she is so knowledgeable about everything. And she laid everything out for my family and I. Transplant aside, she also gave us other options and statistics, and she really empowered me to make the decision, which I really appreciated. And I think now that I kind of have an inside look as to, how medicine essentially is performed, I really appreciated that, she empowered me to make the decision, that I wanted. And I think, because I did have a half match in my younger brother, and, just because of all of the statistics that related to, my personal health, that was the best option for me. And I'm just so grateful that, she kind of laid everything out and, told me, this is what could happen. I mean, you guys all know that medicine is so experimental, excuse me. So she really couldn't give me, specifics, but based off of, other patients that had been through the trial that were a similar age to me, she was just so helpful throughout the process. I think, honestly, like, not related to medicine, but I wish that I would have, I think, like, in aplastic anemia, sometimes it can be challenging because there aren't very many of us. There's 1 in 2 million essentially every year. So there's not many of us. And I think for me, I would have loved to have spoken to a patient, that had been through the transplant process. I think I would have been more prepared in that sense. Like many of you on the phone, I mean, I was very healthy as a child, as a teenager, as a young adult. And then, you know, I got aplastic anemia and my case was completely idiopathic. So there was really no rhyme or reason as to why I got it. My bone marrow was damaged somewhere down the line. But I think, you know, because there aren't many of us, it was challenging to try and, you know, relate to other people that had been through these experiences. But I think the Aplastic Anemia and MDS Foundation is just a great resource to, you know, collaborate and meet with other patients and families. So would, you know, just recommend that to anyone that's kind of in the beginning stages of treatment. You know, they're a great resource, and, you know, they can really help you, you know, connect with others.
Yeah, I definitely agree with what you said. I really don't have, from what I remember, I don't think there was anything extra that the doctors could have said or done to make the process better. I think the process was very, very smooth. The doctors and everyone involved at the hospital was just absolutely amazing, like throughout the entire process. And I'm also very lucky that I have aunts and uncles who are all doctors that work in the Cleveland area. So when me and my mom didn't have the right questions to ask or didn't know what questions to ask, we had them in the room with us to ask the right questions, to get out the extra information that maybe wasn't passed along. So I was very fortunate in that. And like you said, Paige, I wish I had reached out to more people with aplastic anemia while I was going through treatment. I remember the option was given to me through whether it be my mom wanting me to go and do it or the doctors wanting me to go and do it. But I was very against it for whatever reason when I was younger, but something that I'm definitely a lot more interested in doing now, in reaching out to people who are going through it currently, or like this panel. I would love to be more involved in the community of people going through this or have gone through this. And so, yeah, I just wish I had done that more back then.
I couldn't agree more. Just, you know, last kind of tidbit from me, but yeah, I mean, I think anytime you're able to relate to someone on, you know, an experience, like sometimes at first it's like, well, let me get through it and then I'll connect. But totally agree, Justin. I wish that, you know, I would have reached out. I think now, you know, being 3 years out, I've just had so many weird experiences and coincidences where I've met people with aplastic anemia or other forms of bone marrow failure. And I can't even describe the feeling, but it's just so cool to be able to, you know, connect with someone who essentially, you know, shares a same part, you know, of something that you've been through. So yeah.
Well, I think our time is up. So I really appreciate you guys sharing your stories and being vulnerable and opening up today. It means a lot to, I'm sure, everybody that's on this call and listening and hearing that they're not the only ones. And thank you so much. I really appreciate it. And thank you to Dr. Rotz for sharing his PowerPoint earlier.
Well,
thank you guys for this opportunity.
Great. Well, thank you so much, Dr. Rotz, Taylor, Justin, and Paige. And I'd like to say to Paige and Justin, thank you so much for coming on today, sharing your personal stories. It takes a lot for patients to share about their journey, and your sharing really does help inspire and encourage other patients, you know, to keep going, and that they can be survivors such as yourself. So thank you very much for being so open and candid today. It's very much appreciated by all of us. If you would like to watch this program again, this session at a later time, it will be available on our website within 2 to 3 business days. If you have any additional questions, please feel free to send them to us at any time in 3 ways. You can send an email to help@aamds.org, call our helpline at 800-747-2820, extension 2, or submit a question on our Facebook page. We are hosting support groups, which will start right at 4 o'clock. Everyone that was registered received a personal email from me, so you have access to the link there. So please feel free to join us at 4 o'clock if you're able. If not, this does conclude our conference for today. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today and making us your resource of choice for information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board and team are here to support you and your family as we've done for the past 36 years. Thank you again, everyone, for joining us and making this a great conference. This concludes our conference. Thank you.
Thank you.